We have heard a lot from health officials about COVID-19 and the continued impact in our region. WJHL.com digital reporter Jeff Keeling has been looking into the Northeast Tennessee data, as he has been for over a year now. Jeff, numbers have come down a bit in the region recently, and that's been very encouraging. But some regional numbers don't stack up favorably when it comes to the overall rate for Tennessee, right?
That's right, Josh. That includes COVID rates and health impacts as well as vaccination rates. And here's what Sullivan County Medical Director Dr. Stephen May told me.
We're still a hot spot, but it still gives us concern, and I think we need to follow this over time to see what is the real trend.
It does not sound like Dr. May thinks that we are even out of the woods yet, right?
That's right.
Not there at this point, unfortunately.
No, what I learned is I've been tracking these rates closely, and most of our counties have been consistently above state averages for weeks now. I looked at the data from the last 14 days, and the first graphic that's behind me shows the average number of new daily cases per 100,000 population. That's what we call the community spread rate. We've heard about that for months now. It shows our region at 18.8, the state's at 13.7, so we're nearly 40% higher than the state.
Okay, put that into some context. I know the CDC has been given some guidance on when it comes to what that means and what spread rates we're looking at.
Sure. They've got what we now call 5 zones built around the risk of transmission in schools. The highest risk, higher risk, moderate, lower, and lowest. Anything above 14.3 puts you in that highest risk category, so our region is a good bit above that threshold again, and the state overall is in the higher risk category.
Okay, now we've learned over the past year that numbers can sometimes be deceiving, so could it be that we're just doing more testing in our area? Have you looked into that?
Yeah, it could be that we're doing more testing in our area, but we're not. We're actually about 20% lower than the state's rate in testing, and that shows up in test positivity rates actually. So if you'll look at this graphic, the region's rate is almost 10%, and that's about 80% higher than the state rate of 5.5%. As of yesterday, Sullivan County's 14-day positivity rate was the third highest in the state. It was over 15%.
You have said the CDC even has some guidance on those numbers as well, and that might provide some more depth of understanding here.
Yeah, they say that 10% and up puts you in the highest risk zone, again with that school transmission risk, so our area is hanging right around that mark. The state is in the moderate risk category, which is between 5 and 8%. I will say our region's numbers are down from a spike about a month ago. They got up to 15, 16%, but they haven't changed that much the last couple of weeks. They're just hanging around that 10% mark. They had gotten down around 7% at their low.
Okay, we are often hearing what officials are saying and what, the numbers are showing. Ballot health officials have said that the disease is still making people very sick, even as it hits younger members of the population. I think this week they said their average age is around 60 now in the hospital. What do the state numbers show you?
Sure. So let's take a look at hospitalizations first. This graphic shows another pretty big gap between the state and our region. This is the hospitalizations per 100,000 over the last 2 weeks, 9.9 in Northeast Tennessee. That's about 50%, more than 50% higher than the Tennessee rate of 6.4. So we've seen that in Ballard's reporting as well.
All right, the difference in hospitalizations even worse than the difference in cases.
Right.
And I know this is confusing. It's tough to keep up with, but looking at hospitalization and cases, there's a difference. What about deaths? I know that's another number you're tracking.
Right, and unfortunately those numbers are far below what they were back in the winter during the surge, but we are steadily averaging about 1 reported COVID death a day over the last month. And you look at this graphic, the numbers are, for the past 2 weeks, 2.6 in Northeast Tennessee. That is more than double the state rate. So again, we're seeing more severe impacts in our region in hospitalizations and deaths than the state as a whole.
Good to see that number going down.
It is.
And that's certainly what we want. Your reporting showed the region ahead of Tennessee when it comes to the number of vaccinations for several weeks. And that was great, and we were very encouraged. I know health officials say that that's a key to getting ahead of this virus and moving on beyond a pandemic. How's that going now?
Well, unfortunately, we have slipped in that regard. And Tennessee ranks in the bottom 5 in first doses administered among the country, and they caught up to us in the region here. And then look at the last 2 weeks. We're at 1.9% additional population percentage vaccinated during the last couple of weeks. That is a good amount above what we've done here in Northeast Tennessee, 1.5%. Essentially, that's about a real snail's pace. And what Dr. May says is vaccinations are the key to getting a hold of this thing, getting ahead of this thing.
All right, Jeff Keeling, incredible reporting as always. Thank you very much.
Thank
we
you, John.
appreciate it. You can find Jeff's COVID-19 data broken down daily on WJHL.com. It has become a real source. Thank you, Jeff. Coming up, President Joe Biden back on the road touting the American Jobs Plan.